This semester in one of my classes, me and a group of students created a walkathon which spread awareness towards mental health resources and mental health facts and statistics and was trying to end the stigma around it. We also created a GoFundMe page for the Newport County Community Mental Health Center, which raised a good amount of money for the new facility. And we chose to donate to you guys because we feel that you're such a great organization who's helped so many people.
Early intervention and therapy is important for any age. I was adopted from Russia when I was 3, and I had an incredibly difficult time adjusting to the private school life. I didn't fit in, and I was tormented for my different family backgrounds and interests that did not conform to the private school social norm. I developed anxiety at a very early age. I didn't start seeing a school counselor until I was a freshman in high school. I think that some form of therapy treatment within the gap from elementary school to high school would have made a significant impact on my mental clarity and how I chose to react to anything outside of my comfort zone. I don't think that therapy needs to be this scary, stigmatized idea where you immediately get labeled with a disorder and comatose with medication. I really encourage anyone who's struggling to reach out to us. That's what we're here for.
We're very excited about our new program called Healthy Transitions, which is an expansion of Newport County Mental Health. This program is targeting the population between the ages of 16 and 25 years old. And we're going to be treating people that are experiencing serious mental illness, basically for the first time. So we're hoping to intervene and provide some early intervention for clients that may be having their first major depressive episode or their first psychotic episode. And we hope by intervening early enough that they can go on to lead productive, meaningful lives.
In my role, I provide individual therapy to children and adolescents, but instead of being in the office, I'm able to provide that at school for kids. So for kids who are not able to get to the office because their parents have transportation issues or multiple after-school activities, but kids really need services, I'm able to go into the schools to provide that there. It's been very exciting working with high school students, knowing that this program is coming, because I do have high school students who have significant needs, much more than a 45-minute individual therapy session. So it's exciting to know that those students will be getting support and still being able to receive the individual therapy services. I have some high school students now who I think are great referrals, so I'm in the process of getting them over there as the program opens up.
I've been very fortunate because as a deacon who was ordained in 2013, my extra parochial ministry was the St. Matthias Ministry for Recovery for Addiction and Alcoholism. So I'm the cleric for the Diocese of Providence who works with these things. I kind of are always in everyone's face talking about recovery because that's my main ministry. And I've gotten some great support from Jamie and the whole crew down at Newport Mental Health. I hear that Newport Mental Health will soon have a facility in the Valley Road area that will be focusing on supporting individuals in the younger group, the 16 to 20-year-old range of people. And that's very often when all of these issues begin to manifest themselves, particularly when folks pull away from their parents and start to become individuals and then experiment. And then that experimentation sometimes turns into addiction. And it's almost impossible to pull away from it because the combination between peer pressure and sometimes not feeling like you fit in and all of the other things that go on with that period of time in people's lives. But as a cleric, to be able to send someone to some place who's professional, who knows what they're doing and can offer help either as a peer recovery specialist or even counseling and more in-depth mental health issues and recovery issues, to me that's an asset and a tool that I need to have in my toolbox.
I feel the center would be very beneficial to the students or to any young adult for that matter, in helping developing interpersonal skills, helping building relationships, building confidence within themselves, and also being a place where one can go and feel comfortable about sharing their views without worrying about being judged, and learning problem-solving skills in order to help them pass through what's going on with them internally.
We offer individual therapy, family therapy, and prescribing services to youth as young as 5 years old who can come to our clinic via our open access program and receive clinical support. And that could come in all different shapes and forms, depending on the age. We do a lot of play therapy for kids who are a little bit older. It takes on a different shape. It could be talk therapy, expressive arts, and we provide service to many different sorts of clinical needs, meaning kids who might have depression, anxiety, or trauma can come to us for services.
Although I am only months new to Newport mental health, the work I see being done around me is raw and inspiring. We have a very strong and solid team of people and departments working endlessly to improve our social networks. And I think specifically, for our youth, it starts here, it starts with us.